performance psychology is about getting to the next level of whatever it is you want to improve in your life. There's some study out there that shows that we're capable of pushing ourselves 40% more than we think. I call it the MVP process, the M standing for mindfulness, the V stands for visualization, and the P stands for that positive coaching. I love evolutionary psychology. So much of what we do is rooted in the dawn of human civilization. The way we bonded with each other was by walking together, by running together, by traveling together, moving side by side together. When you're running, it allows you to access a part of yourself below conscious awareness. Hypnosis is extremely powerful tool that we have inside of us.
When a lot of people hear the term hypnosis, they think woo-woo. So what do people get wrong about hypnosis?
You are always in control.
What is up, guys? Welcome back to Post Run High. I am sitting here today with my mother-in-law, Dr. Dana Lebo. She is a psychologist that has been practicing for over 30 years. Dana, how are you?
I'm doing great, Kate, and I'm so thrilled and honored to be here. I've been watching you for, well, a little less than 30 years, but just always, before I go to bed at night, I watch Post Run High just a few minutes. It's kind of my ritual now, and I am definitely one of your biggest fans.
Well, I am so excited to have you on Post Run High. We've had you on our running interview show quite a bit. So those of you that watch our running interview show are definitely familiar with Dana and her story. And today we just have the opportunity to go a little bit deeper with you, which I'm super excited about. So we are doing a little bit of an extended Post Run High episode, and that is because we ran yesterday. We kind of did a run walk, if I'm being honest. But we did a run walk yesterday, and
it was 84 degrees.
It was 84 degrees. We're here in California on a family trip, but now a few hours later, we are sitting down for our Post Run High episode. So how are you feeling?
I'm feeling great. Yeah, after my morning coffee and sitting here with you, ready to go.
Yeah, the coffee's important.
It sure is.
So, Dana, the last time we saw you, or my audience saw you, was at the New York City Marathon, where you fell around mile 12 and broke your arm. Can you talk to us a little bit about what happened during the race and then what happened after?
Well, it was a point, Kate, where the roads kind of converged. There was a lot more people kind of crammed together on a narrower road. And I was running with this wonderful pacing group and trying to make sure not to lose the head pacer. And one guy was running around encouraging everybody, and he put his arm around my shoulder while we were running, and he's like, "You're doing great, keep going." It just threw me off balance a little, and I don't know if it was a pothole or what. The ground was uneven. We were packed in like sardines, and it just happened so quickly. I went flying, and I remember, thank God for my arm, because that's what stopped me from hitting my head on the ground. And the thing is, though, I knew something was wrong, but what went through my head immediately was, you've got to finish the race. You've got to finish the race. And here I'm lying on the road. I think a couple people had stopped to prevent me from being trampled. But I just lucked out. I lucked out because there was a volunteer on the side of the road. She brought me to the med tent, and it was only like half a mile away. I mean, I fell at a great spot for support and help, and there were 2 sports medicine doctors. I knew it was bad when a couple things they said. When you get to the ER, if they offer you morphine, take it. and they also said, in response to my pushing to, can I go? I wanted to meet you guys at mile 16, and I wanted to cross that finish line. I think that's what goes through any marathon runner's head. I mean, you're there to finish that race, come hell or high water. And they said, look, you could die if you keep running. And then explained, they didn't know how badly the bones were broken, that anyway, I could have cut into a vein or something with a jagged bone. I mean, too much information, I know, but they convinced me that it was not safe to keep going. So they were wonderful, though, put me in an Uber to the ER. And I was just blown away. I know you and Jeremy came and you took pictures of those x-rays, and then my daughter's pickleball partner's brother-in-law was a top hand surgeon in Maryland, and he's seeing the x-rays that you took pictures of just a few minutes later, and then they're being sent to someone at Duke University who was his best friend as a resident years ago, and he was a top hand surgeon in North Carolina where we live. I just lucked out. Within a couple days I was in surgery, and as you could see, cast is off, even though I do have to wear it. I have to wear it when I run, and just to be safe. So yeah, I was able to do the turkey trot. And even though the hand surgeon said to me, don't try to win the race overall, don't try to get a PR, I did win my age group. And then a couple weeks later, I ran another race. The turkey trot was 5 miles. This one was a 10K, and I won my age group there. I guess when you get older, the competition does thin a little, but I was able to run more slowly and still win. So that feels good. I needed to cross the finish line again. And so I've been able to do that a couple times since the fall.
Yeah, I think runners are definitely built different. It's like something goes wrong, something happens, and all us runners want to do is get back out there and be able to go for a run again. And I've been in similar situations where I've been injured, where I've had knee injuries, where I have to wait and wait and wait to get back out there and go for a run. And there really is nothing like it. And I feel like going through these types of injuries makes you appreciate having a healthy body and being able to run so much more.
Absolutely, yeah. And I think that's it right there, Kate. You don't realize how much we take for granted when we're fully healthy and, everything is working. But when something goes wrong, it just makes us appreciate how we've got to take care of ourselves. And I think there's a lot of runners who, there's always something, especially as you get older, there's always something that is bothering you, whether it's the Achilles or the calf muscle or, a hip has just a few months left before it needs to be replaced. There's always something.
There's always something, and I liked what you said when you were talking about what happened during the race. You said, come hell or high water, as a marathon runner, you want to finish that race. And obviously this was a unique situation. You fell, you broke your arm, you had to get a couple screws and metal plates put into your arm. So this was a serious injury, but I'm sure there's been times in your 18 plus marathons that you've had leg cramps or things that happened that made you want to stop, and you've been able to push yourself through.
Yeah, absolutely. Yeah, I think you're getting at, Kate, what every runner faces, whether you're long distance running or even if you're running a 5K or 10K, whatever it is. I think you reach a point or some point in the race where you hit a wall. Walls are famous in marathons. They usually happen around mile 21 or something. I've had the wall hit me at mile 11, and you just are running thinking every bone in my body, every tendon, every muscle is screaming stop, and you just want to curl up on the side of the road in a fetal position. But you've got to psych yourself in that moment, and I know you've been through it too. I've seen your documentary, and I think it's a combination of, I call it the MVP process. We all think of MVP. It's a famous acronym, but I like to think of the M standing for mindfulness, which just kind of take a few deep breaths. The V stands for visualization. You visualize something that keeps you going. And it's different for everybody. You could have like 15 or 20 things that you might visualize that psych you up in that moment. And the P stands for that positive coaching, that you kind of stand outside yourself and coach yourself. You've got this, Dana. You know you can do it. You know you can push through this. Just keep going. And so combination of those three things, everybody can kind of tailor it to themselves. For the mindfulness piece, I kind of look around and remind myself to enjoy what I'm doing, to take in the sounds of the roaring crowds, to feel the rhythm of the run, the pace, the beat, of even my heart as I'm running. You kind of get into a music. And so that's the M for mindfulness. And then V, I visualize. I mean, I have so many things I visualize. Sometimes I'll visualize someone I know who's not doing so well and, maybe is ill or has an injury. And I think, I'm running for you. I'll imagine that I'm carrying them with me. And that really gets me going, just to think I'm still vertical, I can keep running. And so, for some people it might be visualizing even the finish line. There's actually been studies that show that runners who think about the finish line, visualize it as they're running, it actually helps them speed up and keep going. So I might be at mile 16 and I'm imagining that finish line and what it's going to feel like when I cross over it. So that gives me that little boost. And then just kind of the things I say to myself. Dana, you've been here before. It's hard, but your body can do it. There's some study out there that shows that we're capable of pushing ourselves 40% more than we think. And I just tell myself that. You've gone 10 miles and you feel you're at your limit, you can go 4 more, at least. And I coach myself as if I'm my own coach, and it gets me through. It gets me through. MVP. And, I think the hardest thing about sometimes being a psychologist and just being a human being is we're all capable of giving other people advice and helping coach other people. But sometimes the hardest job is when we have to coach ourselves, right? But you've been capable of coaching yourself. And if you don't mind me saying, you've only been running since you were 50 years old, right? Well, yeah. I mean, I jogged a lot to stay in shape up to that point. I mean, I did run when the kids were little. I had a single jogging stroller, double jogging stroller, and then, believe it or not, before jogging strollers were even popular, my husband and I managed to find a triple jogging stroller. So we would be running on the side of the road with our triple jogging stroller at a time when no one even thought about using strollers for jogging. And we would stop traffic. Couldn't believe that we had 3 little ones strapped in running along. So yeah, I ran just to stay in shape, but I never thought that I could run distance. I mean, I remember thinking, marathon, that's unbelievable. And my husband started running them, and a couple times I would meet him with maybe 11, 15 miles left for him to go, and I know it's not good, but I would get on there and just kind of run bandit with him. And I know that's, we're not supposed to do that, but
what do you mean by run bandit?
Well, I wasn't registered. I didn't have a bib. I just would kind of get on the course and run with him. And these were local, informal marathons. And I would notice running the last 10 miles, I did that with my daughter also, that there were a lot of people walking. And I thought, I didn't know you were allowed to walk. So why can't I do that? I'll try running a marathon, and if I get tired, heck, I'll just walk. And so we signed up for I think it was the All-American Marathon near Fort Bragg in North Carolina. And my God, I remember passing the 10-mile mark and thinking, wow, I feel really good. I was 55 years old at the time, and I'm looking around, I don't know where my husband went, and so I just kept going, and I think at mile 16, I hit a wall, and I don't know what a wall was at that time. I just felt like okay, if you're gonna walk, walk now. But what I did instead was, I remember calling up my daughter, and she had her whole family around her, and I said to her, Sandra, I feel like I'm gonna die. What do I do? And she said, Mom, just keep going. And she said, we'll call you every 5-10 minutes just to give you a boost. And she did. She called me. The whole family was cheering for me on the phone. And I remember just drinking in that energy from them and thinking of my grandson at the time and granddaughter, and just seeing their little faces, smiling, hearing them cheer for me, and it kept me going. And I'll tell you too, at that particular marathon, there was a mile where they had flags of fallen soldiers. And I remember running through that mile, just so overwhelmed by emotion. I was crying. I don't think I've ever cried while running, but I just remember the tears and so impacted by the thought of, the lives that they gave for their country. And it pushed me that, we can still run and we can still move forward, and that they would want us to run and to keep going and to impact the world in some positive way. So that really empowered me too. And, I was thinking a member of our family was very sick at that time.
Mm-hmm.
That helped. I thought of him.
Mm-hmm. And the member of your family that was sick was your son, right?
Yeah. Mm-hmm. Yeah. Sorry. That kept me going. Mm-hmm. He kept going. He was sick, but he kept going, and he was an inspiration for all of us. Mm-hmm. He ran triathlons and races and open water swims, and his skin was gray. He was so sick. But he kept going, and that just inspired me. And so all these thoughts, I think, go through the marathon runner's head. We can run because we can. We can run because we can. And so when you hit that wall, that's what you think about. And suddenly the finish line is there within sight. And there's nothing like crossing over it. And then knowing, too, even though it's the finish line, there'll be another start soon. There's always another run, no matter what race that you decide to join. And I'll tell you, even at the New York City Marathon, when I fell, I realized that we all get tripped up on the way to a finish line. And so then we've got three choices. We can either push through, crawl, scramble, do whatever we can to still get to that finish line. If it's against medical advice, we might need to listen. We could also postpone the finish. We always have that option. There's always another race. Just put it off and take the time that we need to heal. And then, too, we can reroute. We can change the story. We don't have to cross that finish line. There's other finish lines. We can change the story, and I think that's what I did. I met so many wonderful people getting hurt. I have a different story. Haven't quite crossed the New York City Marathon finish line, but I've crossed others.
Well, you have crossed the New York City Marathon finish line.
Well, a couple times before, but I mean, there's
year.
Always next year. Yeah.
There's always next year. And I think the beautiful thing about running is, even if, whether you're doing a race or going out for a 3-mile run on your own, it's never guaranteed that it's going to be a good run. And I think that's what keeps people going also, right? It's the ability to say, okay, this challenged me, and now I want to come back and do it again and do it and be stronger this time, right? And that goes for running or just working out in general, right? There's always those times where the workout and the practice of doing it is going to challenge you, and that's where the mental toughness comes in.
Yeah, absolutely. Mm-hmm. Kate, it is a little different when you're older. I'll be honest. I'm
You did say that too. I have to shout this out. So Dana and I, we did a video for where we were picking you out a race day outfit. You're actually wearing one of the shirts that we bought you.
Yes, I am. This was the shirt I fell in.
Yep. This was the shirt that you fell in. And for our listeners, she's wearing a light blue Viore long sleeve top. It's Go Carolina. I know you got it because you wanted to be repping your Carolina blue, which is where you live in North Carolina, and where Jeremy, my husband, went to UNC, your son. But When we were filming, you said something along the lines of you don't know if a bone's going to break or a hamstring's going to give out, because at 65 years old, just anything can happen. So
Yeah. And I got to tell you, there are a lot of runners out there that are much older than 65. There's nothing more inspiring than to be running a marathon and seeing someone who's like 82 years old just pushing along and one step after another. I think that we can stay in as good a shape as possible, Kate, as we get older. Yet, there's also reality that we're not young spring chickens anymore. I mean, we don't have the same bodies we did when we were 24 years old. So it's hard. It's hard to honor what our bodies are telling us sometimes. And I mean, I know I have run through injuries trying to ignore what my body's saying. And yeah, I know you said that we don't necessarily practice what we preach or walk the talk, or I know right after my surgery the next day, I was back to work, with all the pain and everything.
Right.
And, some of the team was teasing me like, Dr. Lebo, here you're telling everybody else to take the time to rest and recover, but you're back here without giving yourself that time. And so I think, sometimes as we get older, we think there's not as much time ahead as we've had behind. And so maybe there's renewed urgency or something, and it doesn't have to be running. It could be anything to still keep some passion, still keep something going in our lives that we love, that gives us meaning and purpose. I mean, running is just one piece of life. There's so many others as well. And, as you get older, you get better in so many ways. I mean, I know we were talking earlier about how some people actually run better, improve their times as they get older. And I know I certainly have. I don't have much comparison from when I was younger. I just jogged. But, I found myself for some years getting better and better each year. And there's that, I guess, exhilaration that we don't have to let age defy us or deny us. I mean, there's so many athletes out there, Olympians, who have shown us that, hey, I'm 36 years old and I can still win the 50-yard dash or something, or sprint in the water. And I mean, that are just modeling to the world that we don't have to give up. There's so much more we could do as we get older and wiser.
Mm-hmm. And a couple weeks ago on the podcast, we interviewed Nicholas Thompson, who's the CEO of The Atlantic, and he's also in the age group over 45, but he holds the world record for the fastest 50K for men over 45, which is about 30 miles. And he was saying that in his 30s, he was consistently running a specific marathon time, and it was a fast marathon time. Like, he was in the sub 3 hour category, right? So he's running a fast marathon, but he got stuck at this one time and he couldn't break out of it. And then finally he describes it as a psychological breakthrough, and all of a sudden in his 40s he was able to significantly drop his time by about 10 minutes, where he's now running a 2 hour and 28 minute marathon.
Wow.
What do you think happened to cause a psychological breakthrough that allows him to go faster?
It's interesting you asked that question, and I don't know if it's just for runners. I think it's for athlete in any sport. I honestly believe it has something to do with being fully in the present moment. You're just being grounded in what you see and hear and feel and smell as you're moving, and you're just so at one with kind of that in the zone force. Nothing hampers you. Mm-hmm. Your mind doesn't get in the way. You're just free. I think it's a freeing process. And there's a love, there's a passion. You're feeling it in the moment. So we let our minds get in our way so often, but I imagine he was just fully at one with just running in the zone, just fully absorbed in it, and nothing, nothing in his head was in the way, or worries, concerns. He just let all that go and broke through that barrier.
Yeah, and the way he described it too was that he had cancer in his early 30s, and before having cancer, he was running a fast marathon time. And then when he got back into running post having cancer, he was just obsessed with being able to be as fast as he was pre-cancer. And then all of a sudden, the psychological breakthrough came as soon as he realized, why am I being so hell-bent on running the same path at the same time that I did pre-cancer? And as soon as he left that behind him and kind of focused on what you're saying, which is the present moment, he was able to break through and not hold himself to that one time.
Yeah, because we evolve. He evolved to a different person, and let go. It sounds like he finally let go. And in so many ways, that's freeing when you can just let go and be in the moment and just thrilled that we're alive right now.
Right. So you're a psychologist that's been practicing for over 30 years. And during that pre-marathon Viore run that we did, getting you your outfit, you also said something interesting that was people hit the wall in marathons. And of course, when we're talking running, it makes a lot of sense to use hit the wall as an example. But people hit the wall in life as well. And you also described yourself as a performance coach. So can you talk to us about that?
Well, I think, Kate, we all have things in our lives that we want to improve in. And performance psychology is about getting to the next level of whatever it is you want to improve in your life. It could be a skill, it could be a behavior, it could be a mindset, even a mood. And so, what happens between where we are with whatever that skill is we want to get better at, or behavior or mood or mindset, whatever it is, and between where we want to get. And I'm sorry, my arm is still shaking a little from the, hold on. This is my arm that I broke.
For our listeners, Dana's currently using her broken arm. So don't worry. Most people are just listening, so you can just relax that arm and you can.
But I need to gesture. So we're here with whatever we want to improve at. We want to get there. So the question is, not where we are or where we want to be. It's more about that gap in between. If we can tackle one thing in that gap that can help us get from here to there, that's how we get through that wall. And so when I say tackle one thing, it could be something about ourselves that gets in the way. Like, hey, I'm too impatient, or I procrastinate, or I'm not focused, or, you name it, fill in the blank, X, Y, or Z. It could be something we want to build on, like I'm working on stamina, and I need to get 40% better. Or it could be something even about the situation we're in that we want to change. But there's usually something in the way between here and there that we need to tackle. And it's something specific, and we know what it is. If we are uncertain what it is, we could ask the people who know us, love us, are around us every day. They'll tell us what it is. But there's usually one thing, or other things too, but one thing that if we tackle that, it's going to help everything else. And so I think as a performance psychologist, it certainly makes my work easier to focus on that one thing, whether it's for an athlete or someone in the workplace, or someone who's started a foundation and hitting a wall and fundraising, whatever it is. If you could tackle that one thing and get it to the next level, it can help everything else. And so that's, I think, we've all heard the expression less is more. And so just one thing, what's that one thing between here and there that's either holding you back or you can build on that will make all the difference? And I think that's what performance psychology can help with. There is such a vast amount of research out there that shows us what the cutting edge techniques are, what the best practices are, what the most effective approaches are to help anything we want to get better at. Now we've got AI. We could ask ChatGPT, but there's always some approaches, methods, treatments out there that are just best in class. And if we can find those and customize them, apply them to whatever the person's trying to improve, there's going to be some results.
What have you found to be the most effective treatments?
Well, I mean, it depends on what we're trying to tackle. You know, if I'll be honest, you know, if someone's been through some intensive trauma, something like that earlier in life or recently, I mean, I know a lot of athletes who might have fallen also or have some injury, and it's hard to get the confidence back. So there are wonderful experiential approaches, and I believe in experiential therapy. I mean, we could talk all we want about getting better at something, but I believe you need to set the stage to actually experience it again, to reframe it, or to reconstruct the experience in a way that, you know, it's new and different and you can face it differently. So let's say, you know, with my, I'll give the example of my arm. I knew that I needed to get back on the road again, running again. And so I found the first safe way I could do that. You know, my hand surgeon had a cast made for me that went halfway up my arm. And so that helped me feel, even if I do fall, this thing is like turning me into the bionic woman, so I'll be okay. And also, I love self-hypnosis. I know sometimes people get freaked out at the thought of hypnosis because they've been to, you know, a show or something where someone's up there on stage making people, you know, flap their arms like chickens or something. But hypnosis is extremely powerful tool that we have inside of us. I mean, many times a day we go into that in the zone, absorbed state, whether we're reading a good book or driving a car, or if we are watching a movie that has us on the edge of our seat. We can create that in the zone experience ourselves. And if there's an experience that has thrown us off course, we can go into ourselves and revision it in a way that is more fruitful, productive. Here's how I would have liked the outcome to have been different, and I always have a chance in life to make that happen. I could reroute the finish line, that kind of thing. So even in the hospital, Kate, and I know you and Jeremy were so sweet to come and see me in the ER, they had to do what was called a reduction on my arm and kind of, you know, pull it out and realign the bones. And I knew it was going to hurt. And so I said, my God, Dana, if you have ever learned to do hypnosis with others, do it on yourself right now. And I imagined a beach in Hawaii and the palm trees swaying in the breeze and the waves lapping on the shore and the warm sun on my skin. And that's where I was when they did the reduction. And it was before they got the morphine in me. So it was self-hypnosis. And so you can apply hypnosis to so many things to help people get in a state of full absorption and to revision how they want to, whether it's a problem, a challenge, or a new opportunity they're facing, they can see that for themselves in a hypnotic trance. I also like EMDR, which is another approach, eye movement, desensitization and reprocessing. I like to integrate that with hypnosis. I mean, we could go on forever about these mind-body experiential approaches to treatment that help a person be in the experience so they can change it. Even if we're sitting on the couch right now, we could float back to any experience and revision it in a way that's more fruitful and productive, that we could keep going with it, even change the course of history. You know, if I, for example, had a trauma that I faced in the past, I can reconstruct it in a way that helps me move forward. And experiential therapies like hypnosis or EMDR and others help me do that.
Mm-hmm. And there's not that many psychologists that use hypnosis in their practices, right?
Well, I like to think that we can get that number growing. Mm-hmm. And I'm going to do my best to try to bring in more psychologists or therapists clinical social workers, counselors who can learn hypnosis, because it is so powerful.
When did you discover hypnosis?
I realized that we go into kind of a trance-like state so many times a day without even thinking about it, when we're fully absorbed in what we're doing. And whether, again, like I was saying before, whether we're reading a book or
Needle pointing?
Or needle pointing, exactly. You're in the zone. And I remember thinking, gosh, this is such a focused state of attention where we're fully absorbed. Imagine we can train ourselves to do this. And, in moments where we want to solve a problem or shift our mindset or mood. And so I happened to live in New Jersey at the time, and they had a very active New Jersey Society of Clinical Hypnosis. And I went to a meeting to see what it was about, and they hooked me. They were teaching Ericksonian style hypnosis, and I, as soon as I could, got trained in it and then became certified. I went through the training and education with the American Society of Clinical Hypnosis to become a clinical hypnotherapist. And then I became a consultant as well. And I'm actually the president-elect for the American Society of Clinical Hypnosis right now. I just found out a couple weeks ago that I was elected to be that. So I feel like, I hope that with the team working with me, we can use or train more people who are out there, more therapists, to learn hypnosis and to use it with their clients, because it actually, in some cases, it's a form of brief therapy. I mean, you don't need 50 sessions to change your behavior or to improve your performance. 1 or 2 can even do the trick. And it's a wonderful approach that can be integrated with other therapies as well. If you're in a hypnotic trance, you can visualize more clearly, you can learn more deeply, you could see things in your mind's eye better. And it's a way to be more in tune with yourself. And you can integrate that with cognitive behavioral therapy or, other therapies that are out there, that even talk therapy,
So say you're on a run, right? Because I feel like running also is a time, we have a lot of runners that listen to this show, and say you're on a long run and you're in a bit of a trance state, right? Because I feel like when you're long distance running,
Absolutely.
You're in a trance.
Yes.
So now, if you want to break through something on your own and kind of really use that trance state to get in your own thoughts and work through an issue that you're having, how do you do that? Like, what's the first step and then second step and third?
Okay, well, I've already answered that question. MVP process. It's another name for hypnosis. I mean, hypnosis is an integration of, being in a calm, absorbed state, grounded. That's the mindfulness piece.
So the first step is recognizing it.
Yes, recognizing, okay, I'm hitting my wall. I need to do something here to keep pushing through.
Or you're not hitting your wall and you're just in that trance state.
Right.
Because I would kind of want to talk about it in the sense of like, you're going out for a run and you have something on your mind that you want to use that run to focus on. And that doesn't always mean you're hitting a wall. Like sometimes it's an enjoyable run. Like for me, I'm mostly going on enjoyable runs. Let's be real. Yeah.
So as you run, you just start to kind of pay attention to your breathing, the cadence of your steps, almost the rhythm of your pace. And you just kind of get into that flow. And they say that, once you're running or doing anything for 15 minutes, you can get into that flow state, ease into it. And then you're just going and you might hear your heart beating and you're just fully grounded in the moment, one step after the other. And then whatever the problem is, your mind is thinking more clearly. And believe it or not, as we run, because we have to pay attention to where we're going, they call that cognitive load. You have to kind of, where's my next step? I don't want to, fall into a crevice or anything. You're paying attention without realizing it, to keep going. And because you're kind of in the zone, absorbed in the run, you're not overthinking things. You are not ruminating, as the term is. You know, we all talk about, oh gosh, I overthink. You know, I wake up at 2 a.m. and my mind is trying to solve all the problems of the world, and I just want to go to sleep. When you're running, you know, that kind of goes away, and it allows you to access a part of yourself below conscious awareness, and things just bubble up to the surface. You know, ideas that maybe had been suppressed, or thoughts, insights, sensations, they just come to mind. And I think, Kate, that is why when you do your running interviews, people are more vulnerable, able to open up more, you know, or be comfortable with their vulnerability. You're not looking at them eye to eye like we are now. You're side by side, so they feel comfortable. And let's face it, I mean, I love evolutionary psychology. So much of what we do is rooted in, you know, the dawn of human civilization. You know, when we were living in caves with saber-toothed tigers roaring outside, I mean, the way we bonded with each other was by walking together, by running together, by traveling together, moving side by side together. So there's hunting, exactly. You know, so it brings out that primal bonding, I think. And you know, I always think of, why are those running interviews so powerful? I mean, why are running groups taking off by storm? Why are they, you know, even if they're decades old, like I think of the New York Road Runners, I mean, they have just multiplied exponentially in recent years. It's because when we run, we can bond with whoever's next to us and talk about, I mean, surprise ourselves by how much we open up, even with strangers. And so there's something about running, the dopamine, the serotonin, you know, just the blood flow even, that loosens us up. And we're in flow. And when you're in flow, you're not overthinking things. You're just letting go. And so it's very powerful. I think you're onto something, Kate.
Yeah, and you know, I've been doing the running interview show for almost 3 years now, and I have definitely noticed with not only guests but myself that you see these psychological breakthroughs that happen when people are moving their bodies. And it's funny, but when I show up when I wake up sometimes for a day, right? Because I'm doing often 6 interviews in a week. And there's days where I wake up and I'm just like, I don't really want to go for a run right now. And not only do I not want to go for a run, but I don't want to have to do it with somebody else and guide the conversation and make sure they're feeling great, right? Because that is a lot of what I do, right? I show up for people while running and I listen to their story. But what I found with the act of running for myself and also for my guests is, by doing it, I actually my energy shifts and I get into a great state of mind. And even if I wake up and I'm not feeling it that morning, as soon as I start running, in the act of running, my mood shifts and my energy shifts.
Yeah. And I mean, yeah, there's the dopamine surge and serotonin. I mean, we're calmer. We're just more at peace with ourselves, and it feels good to move. We are meant to move. We've got 2 legs, 2 arms. We're meant to move. We're not meant to sit all day. And I mean, they say, I don't know so much about running, but walking alone is, I read one study that said if you go for a walk and you're trying to, you know, process or sort through some problem you're facing, it's can be just as effective as cognitive behavioral therapy or art therapy or just taking a walk. Imagine running. Yeah, you know, where you're speeding things up a little bit, and there's nothing more freeing, liberating than moving.
One of the most common things that people say to me after a run, doing one of my running interviews, is, are you sure we got it all? And I think it's so funny because as somebody that's interviewing them, I know kind of everything that they said during the interview. And I'm thinking to myself, well, we just ran for an hour. Like, trust me, we got the full story. But I think it's so funny because it is one of the most commonality things that people say to me after a run. And I think it's because exactly what you're saying, it's people almost forget what they say during a run. And of course, I know as the interviewer, we got the full story.
Yeah.
But what is that phenomenon? Why do people forget what they say?
It's precisely what we've been talking about, Kate. We're in the zone. And when you're in the zone, and I like to bring it back to hypnosis, that is an example of a trance-like state. We are speaking from that level of awareness below consciousness. It's just bubbling up from deep within. We forget what we say. We're not, calculating what we say. It just flows. The words are flowing out, just like we're flowing in the zone as we run. And so I imagine that, just like me, the people that you interview, I'm going to forget what I'm saying. I don't know what I've said. I'll be probably surprised when I watch later. And they're feeling that too, that what did I mean, it just flows out. And you know that you are locked into a conversation, that you are in the zone when you're not calculating the words. You're not, what do I say next? It just comes. And you can tell just by, the look, the ease with which you're conversing, and how new topics come up. You're pulling from the thread of the previous one. It just flows. We can be in the zone in a conversation just as we can be in the zone, if we're a tennis player serving the ball. That's why hypnosis is so powerful, because we can access that state anytime we want and use it in those moments that would be helpful. Like if I have an anger management problem, if I learn self-hypnosis, the next time I feel like flying off the handle, or I can't beat that impulse to lose control and shout at my little kids and scare them or whatever, I think parents always have those moments at times, and great if they don't. Learning self-hypnosis or these experiential approaches to therapy can help someone in that moment to respond differently to anger or impatience or whatever it is. So I don't know if that did I answer your question?
It does answer my question. And I also want to say, when I hear the term hypnosis, and when a lot of people hear the term hypnosis, they think woo-woo, like, what is that? Crazy town. So what do people get wrong about hypnosis?
Hypnosis is a natural state that we go in multiple times a day. And it is not something, from left field. Maybe we should change the name. That's why I like MVP, the MVP process. I mean, that's really what it is. It's a combination of mindfulness and visualization. And when I say visualization, it doesn't have to be just seeing things. It could be, the smell of your mom's brownies when you were 12 years old, how that always made you feel like home. I mean, it could be any kind of sensation. And also positive self-talk, coaching, setting expectations for yourself, to respond differently in a new pattern that is more productive and effective and that makes sense or can be adapted to, where you are today in a more productive way.
So now what are we seeing when we're on a cruise ship and there's a hypnotist on stage, right? Or whatever, wherever we are when we see a hypnotist on stage, maybe in middle school or, when they bring in somebody like that. What are we seeing when people become a car on stage? Do you believe that? Could you right now hypnotize me to make me become a car and, look like I'm driving the wheel and saying vroom vroom? Like, what are we seeing?
If we had time, maybe I could, but but I won't. I think it depends. There are some stage hypnotists who really know what they're doing, but then hypnosis is used for entertainment. You're just unlocking something within a person that helps free their inhibitions. But keep in mind, that person is always in control. Hypnosis does not take control away from people, and I think that's the biggest fallacy about it, that if I am hypnotized, I'm going to lose control. That is not correct. You are always in control. And so my hunch is there might be a lot of stage hypnotists who have actors or actresses planted in the audience. I mean, we see movies about that all the time, that like their daughter's out there and raises her hand to volunteer and knows, has a whole act planned once she gets up on that stage. But, hypnosis does not rob people of control. It's just a natural a state that we can all go into to access, our deeper, higher inner selves. As woo-woo as that sounds, I mean, isn't that though, one of the goals in life, to understand ourselves more clearly?
Yeah, and I've interviewed a handful of professional athletes. I've interviewed Gabby Thomas, Sydney McLaughlin, Grant Holloway. Those are all tracks, gold medalist Olympians that are runners. And one of the things that they all talk about is visualization. And I know you've talked about visualization as it comes to hypnosis and, getting into trance-like state when you're running. So explain to us what visualization is in terms of performance for people at that level. And then also, I know you work with retired athletes and CEOs, executives, right? And I'm sure there's things that they get wrong about visualization that you have to recoach. So talk to us about visualization and what people get wrong about it.
Well, I guess the first thing that comes to mind is what people can get right about visualization. I find that I could work with a golfer, and even though I myself am not a golfer, okay, what's that movie with the happy place? Happy Gilmore, or what is it? And Adam Sandler, the Happy Gilmore, and part 2 just came out, and so everybody's like, oh well, I'm going to use hypnosis to go to my happy place, and that's awesome. If we could all, whether we're a CEO of a big company or just running a mile, if we are going through a tough period, if we can shift to whatever our happy place is, it's certainly going to help shift our mood. I mean, if you can visualize, a place that's comfortable, safe, peaceful, secure, that's going to impact your mood. And mood impacts behavior. Behavior impacts mood. It impacts what we think. It's all related. You can shift in the moment to be more effective, more productive. So that's something, that hypnosis can do for whether you're an executive or an athlete. You can shift how you are in the moment, to be more productive.
Yeah, and to help yourself get through hard things, right? Because when I talked to Gabby Thomas, she's like, when I was competing, I forget her race, but when she was, running in the Olympics and got her gold medal, the only thing she was thinking about was crossing that finish line.
Right, so that's another point that I want to make, Kate. One of the most powerful things we could do with visualization is to imagine the impact of what we're trying to accomplish. So if I'm a tennis player, it's not going to help me much and this is where visualization can be wrong. Like if I'm thinking, okay, I want to visualize my muscles relaxing inside me, or I want to visualize that, I'm standing in that perfect 90-degree angle or whatever with my feet on the ground. That kind of visualization is not going to help as much as, especially for elite athletes, as much as imagining the outcome or the impact of what we're doing. So if I'm a tennis player and I'm serving, I want to see where that ball's going to land. I want to visualize the trajectory of the ball through space. I want to imagine the sound of that ball hitting that tennis racket in just the right place. That kind of visualization is going to free up my body to do what it knows how to do.
And I like that you said to do what it knows how to do, because another commonality that I found with every single professional athlete that I have done an interview with, a running interview show video with, is that they don't get nervous for the race because they know that that's the cherry on top, right?
Yes.
They've put in the work and now they're ready to compete.
Yeah. And that's it. That's the main theme, I think. Free up your body to do what it knows how to do. And the way to do that is to visualize the outcome. That's why imagining that finish line frees up the runner to allow the body to just go at a pace even faster than you thought you could handle. That's why a golfer, I mean, even yesterday, we have that little miniature golf thing outside. I don't know how to golf, but if I stand there and I visualize the alignment of that, of where I'm hitting the ball, seeing that ball go in the hole, sometimes I get a hole in one and I don't know what I'm doing. But I'm just visualizing the ball going into the hole and being aligned with that trajectory. That kind of visualization, seeing the outcome of what you're doing, is so powerful. And you could apply it to even, I know you keep saying, what about CEOs? What do they have in common with athletes or anybody in the workplace? If you're standing up there trying to present your ideas to the board or, to the people sitting at the table at a meeting, if you can think of visualize the impact you want to have, with what you're saying, the value of what you're saying, if you want to see smiles on their faces or you want to see them lean in and open their eyes wide or curious to hear what you have to offer, if you're visualizing that impact, those words are going to flow out and you're going to find that you're smiling, you're leaning in, you're curious about what's going to come out of your mouth too. And you're all mirroring each other. So that visualizing the impact is, I think, the most powerful lesson, whether you're an athlete or a leader in the workplace or a school teacher, whatever. Visualizing the results of what you're doing, seeing that, it helps you even in the moment to get there.
Right. So this podcast is called Post Run High. It's all about the phenomena of what happens after we work out, right? And after we move our bodies. And most people think that post run high is just the endorphins that our body is feeling and experiencing. But is that actually true, or is something else happening?
I think there's dopamine surges, there's endorphins, there's also, the calmness, the peace of, we just ran, we just finished something meaningful, we just moved. I think
we did something hard.
We did something hard, and I think that's another reason why, the running interviews before work so well, because you're both facing kind of adversity together. You're pushing yourselves. There's that kind of bond too. So we just did it. It's like we just crossed the finish line together. Now we're sitting down and enjoying, reaping the joy of finishing something connected together. I think that's the post-run high too.
There are a lot of drugs that can emulate that post-run high, that dopamine, that endorphin rush feeling. What are your thoughts on those types of medications?
Okay, that's a big question. I have some mentors over the years, psychologists who are master clinicians, and they've impacted me pretty strongly. One in particular has a mantra: skills, not pills.
Mm-hmm. And so no Adderall.
Well, hold on. Kate, I really believe that medication has saved lives, no doubt. If I were severely depressed and had a hard time getting out of bed each day, and my psychiatrist is able to prescribe something that will prevent suicidal thoughts or help me feel hope again, okay. Those are kind of severe, more extreme situations. I think in normal life that the first thing to do is to develop the skills to manage shifting our moods, or to manage overthinking, or to manage, anger, or whatever it is. We're human beings, and we always have that capacity to build the skills first. Pills as a last resort. So I believe if, honestly, we go into a doctor's office and say, oh, I'm feeling low or down or anxious, and that doctor pulls out a prescription pad before asking, hey, do you exercise? Do you, move around? What do you do in life that gives you meaning and purpose? And, if that doctor is prescribing pills before asking those essential questions. There's so much research out there to show that, running or other exercise alone is just as effective, if not more so, than any anti-anxiety or any anti-anxiety medication or antidepressant on the marketplace. So it's so important to try to build the skills first and to get the help to do that, because that's what performance psychology is all about. There are best practices. There are cutting edge techniques. There's so much research to show how to build every skill under the sun. Right. And to try that first. Unless, of course, you're in a severe or extreme distress, then okay. Then medication can save lives.
So self-medicate first and then think about
what
comes next.
By building the skills to do that, yes. And we can all learn. That's why I love hypnosis so much. We can learn self-hypnosis. We can learn how to manage a reduction in an ER in wherever I was, I don't know, somewhere in New York City, mile 12, without the morphine.
Say a 12-year-old or 13-year-old goes to a psychiatrist and they're struggling with depression or ADHD. What are you saying to their parents that they should do first, right? And let's start with depression, because that's one of the most common things that adolescents struggle with.
I think every kid's different. And, if I talk to the parents, I would first ask them, what have you tried so far? I try to understand, tell me what you've done so far to help with this challenge you're facing. What has your kid done? And I would explore, what is that kid doing to move in their life? Again, we're meant to move, we're meant to walk, we're meant to run, we're meant to get outside, commune with nature. Nature is one of the things that uplifts our spirits. What about the kid's social connections? Does he have friends? What are the things that child is doing to channel their energy? Do they have some hobby or passion or something they enjoy that gets them moving, that gets them connected to other people, that helps them feel meaning and purpose in life? I would want to explore that first. And that's huge. That is huge, that a child even can play, can connect with friends, can move around, can explore, can be curious, can discover the world. That's what childhood is all about, to learn and grow. I would want to make sure that the child has those outlets. And
it's interesting that it all comes back to movement, right?
Yes.
Whether it's physical, mental, or social, just the act of moving.
Yeah, I can't remember what country it is, like maybe Denmark. They would not allow kids to have standardized tests until they were 13 years old, and instead, spend so much of school time out in the playground. We learn by exploring, by doing, by moving, by being connected to, whether it's nature or something that we could play with and explore, and that's how we learn and grow. And if that's taken away from us, or we're locked into cell phones and computers, and believe me, I know they have their purpose too. I mean, we can do so many things with the power of digital technology, certainly. And however, if we use it too much, it's affecting our brains. It's changing our personalities, and it's preventing all the ways. I mentioned evolutionary psychology before. Our bodies were meant to move, and if we don't do that, we're going to be depressed. I know that if I go a couple days without moving, and I've had knee surgery too, and sometimes you feel it.
Yeah, and there's also there's something interesting to me about social media where it's almost like you are socially connecting, right? Because you go on your phone and you scroll and you see all these people doing all sorts of things, right? And social media tends to make them look glamorous, or so fun, or, makes you have that FOMO, fear of missing out, right? As a psychologist, that understands the importance of being social and knowing what and seeing what people are up to, right? How is that kind of over communication and over seeing people doing different things while we're scrolling on our phones affecting us?
Well, it affects us in a number of different ways. One, I think seeing what everyone else is doing and, feeling that our self-worth is determined by how many likes we get. Not to mention the dopamine surge we get every time we see the number of likes growing. It's addictive. And I know we have apps on our phone to show us how much screen time we're using in a typical week. It's kind of scary sometimes when you see, just the hours and hours that people are spending on their phones. And it is addictive.
Yeah, and I think about it a lot for younger kids, right? Because I've been in middle school, I've been in high school. It was hard enough pre-social media being in middle school saying, oh, so-and-so are friends and they're doing all these things after school and I'm not part of it, right? And then it's a whole other thing where then you're scrolling on Instagram as a 13-year-old and you're seeing all these people again doing things that you're not a part of, So it's like it's already happening naturally, right? You see it in school. There's that comparison. There's that feeling of being left out. And that's the thing that's happened for years and generations. But then social media amplifies it in such a big way.
And I think it kind of circles back to what we were just saying, Kate, that, we especially if you're young and, without all those years of experience and trial and error and learning from mistakes and
understanding that it's okay to be left out, right?
Exactly.
Comfortable in your own skin.
You don't realize that, yet when it's happening for the first few times. And you start to, define who you are based on what you're seeing on social media and defining self-worth and I have to be like that in order for people to love me or like me or to be accepted in this world. And a lot of times, perfection is not attainable. We are human and perfect at best. And yet what we see on social media looks so perfect. And so there's this sort of mirage that, kids might be reaching for that is elusive. And I honestly feel that as hard as it is, because it is addictive, you can't help it. We check our emails. No matter how old we are, once you get connected to a phone, if you leave the house without it, it's like you left your arm behind or something. Everybody's had that kind of experience. But it's freeing, and I've heard a lot of families sometimes do this, to put the phone in a box under a bed or something for the weekend and just to live life without it, to go outside and run, to hike in the woods, to absorb nature, to feel the simple pleasures of living, of being grounded in the moment without succumbing to the urge to see, what the next post is or how many likes or getting that dopamine surge from a little box. We can get that from so many other sources.
And as somebody that's been practicing for over 30 years as a psychologist, you've seen life pre-social media and during social media, right? So you've seen cases of people now kind of coming in, probably because of the effects largely of the phone, especially young kids.
Could be, yeah.
So what is the biggest change that you've seen since the rise of social media as far as like what people are coming into you for help with?
Well, I think it's the same issues, anxiety, depression, trauma, some experiences that may still live with them and haunt them in some way that they want to process or sort through so they can move on in life. And I think that in so many ways, social media, the phone can numb ourselves. We can numb ourselves to dealing with those issues. I mean, it's not, one of my mentors says, it's not depression that happens to us. It's life that happens to us. And if we're spending life scrolling, how are we going to build the skills to deal with problems and challenges that occur every day? And yeah, life is hard. It is rough. And God, Kate, when I think of people living in war-torn countries and how lucky we are, that we can go outside and chances are, we're going to be okay. I mean, if we can just get out and enjoy nature, enjoy connecting with friends, enjoy having conversations, enjoy solving problems without the help of, a computer, just to feel the satisfaction of figuring out things on our own. We have the capacity to do that. Our minds and bodies can work together to help us get the results and feel that incredible satisfaction and high from having crossed the finish line on our own. I cannot cross the finish line scrolling on my phone.
Yeah, and what's kind of funny, but I had somebody say this to me the other day, one of our family members. They said that they enjoy going camping in the mountains because it reminds them of how insignificant they are, right? Just because you're this small speck of a person in this vast mountain range, right? And there's so much nature and life going on around you. And while I don't want to be reminded that we're insignificant, because of course our lives are significant, I think it is so important to be put into that perspective sometimes of being like, my problems feel so big, right? And then you get into the world and you realize my problems aren't that big, right?
Nature's bigger than us. And there's something, no matter what religion you might be or, whether you believe in God or not, we all have those moments where there's a force bigger than us moving through us. And I think you feel that in nature. Nature's a force. We're outdoors. That's how we began. Right. Outside under the starry night, with whatever the equivalent of crickets chirping, we're feeling the breeze, seeing the clouds. I mean, there's something about that, Kate, that no drug can give us. That's how we began. And to return to that, we have the power to do that every day, to go out there. I mean, even there's all this research on, how cities need parks. We need those parks. We need to commune with nature. We need to see trees. There's research on how if we're in a hospital room, recovering from something, if there's a window in that room and there's much more than a window, but a tree outside in the courtyard, the days that we're in the hospital are reduced. There is something about connection with nature and connection with people that is far more powerful than any medication. And so when you are out there camping, yes, we are just part of something bigger than us. Yeah. I don't know if that means we're insignificant, but it's.
But I liked hearing that because it was almost like, it's kind of like art moves you, right? Words can move you. And I liked when he said that because I'm like, yeah. And as much as we're not insignificant, but I do like how you reworded it as the nature is so much bigger than us, right? And sometimes it's important to step into those settings because I think, there's so many just different instances where you can feel like your problems are so big and there's all these things weighing you down. And then it's like, you go into the world and you realize, I'm somebody that lives in New York City, right? There's people that are in war-torn countries, right? It's like our problems could be worse. Get outside, and my favorite thing about talking to you is as a psychologist that sees and hears about such a vast range of issues that people are having, right? From extremely traumatizing situations, people passing away, dealing with extreme levels of grief, extreme levels of depression, anxiety. Like there's so many issues that we can face mentally. but just by getting outside and moving your body
And connecting with people too.
and connecting with people and yourself in a deeper way, that can cure you.
Absolutely. Yeah, Kate. And I think, it helps us to circle back to where we began. We were talking about running, being in the zone. That is when there's a force bigger than us going through us. And we can make that happen anytime we want by doing what we love, whether it's painting or writing or running or playing tennis or standing up in front of a crowd, pouring our hearts out about what we're passionate about and feel has meaning or purpose. Connecting with people, building communities. We are in the zone in those moments. And if we, people can find those moments in their lives, and, we can't help it. It's part of being human, but just to have 2 moments like that in the morning, 2 moments like that in the afternoon, 2 moments like that in the evening, that is a meaningful, purposeful life.
Yep.
Yeah.
And if it was easy, it wouldn't be worth it, right? And I want to just circle back as we kind of wrap up here, but you broke your arm and had to get surgery during your last New York City Marathon, and about 2 weeks later, you were already talking about all the races that you were signing up for, right? So I also think it's just, while it's important to get outside and move your body, as simple as that may be, it's also important to challenge yourself to do hard things. And you now have coming up in the next several months, you're going to be doing the Berlin Marathon, maybe the Chicago Marathon.
I got into the Chicago Marathon and
the New York Marathon.
Everybody keeps telling me I got a redemption journey, do New York again. I'll be honest, I don't know if my legs are capable of doing 3 marathons in I think it's 5 or 6 weeks, the way they fall schedule-wise. But I'm going to do the first one and go all out. That's Berlin. And then see how I feel for Chicago. And if I have to walk half of it, I'll walk half of it. And then 2 weeks later is New York. Again, as you get older, legs aren't what they used to be. But if I have to walk the New York Marathon, I will. I just want to be a part of the experience and to feel what it's like to cross that finish line that I didn't get to this year.
Okay, one of the things that I want to ask you as your daughter-in-law is, I know you've lived a pretty interesting life, right? In high school, you lived in Brazil for a bit. You speak like 6 languages. What made you want to go into psychology?
I think everything boils down to what motivates people across cultures. Everything boils down to why do we behave as we do? And I just wanted to learn how to help people help themselves. I think living overseas, learning from other cultures, seeing the United States from across the oceans, kind of looking at our own country and cultures from a different angle, it just really inspired me to learn how people push through adversity, how they face it, and your adversity is different from my adversity, but that's really what we're all going through in life. Life is not easy, and learning from other people, other cultures, how you face adversity, it inspired me to be a psychologist so I could help people help themselves. And I find that, no matter who I'm working with, I learn just as much, if not more, from them than they could ever learn from me. I think it's just, partly establishing that connection, finding that place where they can help themselves and feel meaning, purpose. That's it.
So we talked about social media. You had a very viral clip that went off 2 years ago when you were running the New York City Marathon, where you ran over to Jeremy, my husband, your son, and you said, "Jeremy, how does my lipstick look? My Maybelline Super Stay Matte Ink, is it still on?" And I think that was at the 22-mile mark. And guys, trust that lipstick was still on. It really doesn't come off even after you shower and eat and all the things. It could make it through probably an entire week. That's how much this lipstick stays on.
More than one marathon, for sure.
But what was it like for you as a psychologist seeing that reaction? Like, what did that show to you about the positive side of social media?
I was blown away, Kate. I think it was humbling to, I like to think, as any other person, we all have our share of accomplishments in life. And then to see that like 2-second thing reached more people than anything I've ever done, that I'd like to think maybe has more meaning than wearing lipstick. I was blown away.
More meaning than wearing lipstick or being in a viral clip online. Yeah.
Yeah, I just was blown away by how some 2-second thing can have such an impact on the power of social media. I think I didn't realize until that viral clip how powerful it is. And I started reading through some of the comments, and there were, my God, there were a couple that made me cry. I just couldn't believe that like 2 seconds can impact someone I've never met. I mean, one guy I think commented about when Jeremy screamed, "Mom, Mom," how it reminded him of when his mother was being buried and they were putting her coffin into the ground and he was screaming, "Mom, Mom," with the same tone, the same intensity. I just burst into tears. I couldn't believe how some 2-second thing with, is still fresh. My lipstick is still going strong. And Jeremy's screaming, "Mom, Mom," how that could touch people in so many different ways. It was an education for me.
Yeah, and even that was 2 years ago, but even this past marathon, we had posted obviously we posted a video about you, after the marathon to say, you didn't finish this marathon, right? You fell at mile 12, you got hurt. But you're already talking about the next marathons that you're going to run, so you're going to come back stronger or walk. And you know what? That's a common experience that so many athletes have, right? Like when I tore my ACL, I had to go through a year of basically not even being able to walk or run, and all I could think about was coming back stronger, right? Mm-hmm. So I think that just shows the grit that people have, and the urge to come back stronger and be able to do what they once did. And obviously there's people that get injured and can't do what they once did, and they come back mentally stronger in a different way.
Yes, that's when you reroute and change the finish line, and it's a different story.
It's a different story. Mm-hmm. And Jordan Litz, the guy that we just had on, you were talking about a decent bit. Yeah. But, that was interesting too, because you touched people there in a way that, I had the people at the medical tent that were messaging me on Instagram saying, "Oh my gosh, like that was your mother-in-law. Like, I can't believe it. Like, I was the one that helped her at the medical tent, or I was the one that carried her out of the race." So it is interesting how these micro interactions can really affect people in a bigger way. And then you use social media to amplify it. And all of a sudden, we had Megan reach out.
Right. And the story of Megan, who now we're best buddies, emailing each other. She got hurt at mile 12 too. Mm-hmm. She was further away from a medical tent, so her story was a little more excruciatingly painful and longer. But we're going to both run the Berlin Marathon next year. We've talked with each other on the phone, and we're already, I'm going to tell her what hotel we're staying at. So I've made a new friend from this.
Let's tell the story of Megan really quickly. So we posted a video of Dana running the New York City Marathon, getting injured at mile 12, then being at the hospital afterwards and having to get surgery. I then get an email the next day from a woman named Megan who reaches out and says, "Kate, I'm so sorry to hear about your mother-in-law. Funny story, but I actually also got injured during the New York City Marathon around mile 12 and have had to have surgery, and you know more about what happened to her medically than I do." Mm-hmm. But she was like, the crazy coincidence here is that, during the last spring, I was running the Boston Marathon with my daughter, and Dana, your mother-in-law, actually happened to be right next to us during the Boston Marathon, and we have a picture to show it, and the picture is you in front of her daughter and her running the Boston Marathon, and she actually has that photo framed in her house. And it was just a crazy coincidence that, X months later at the New York City Marathon the same year, you and her got injured at that same spot. So it's this weird kismet that happened that ended in injury, but you two both have that same mentality of coming back stronger. And she was talking about all the marathons that she's now signing up for, and now you guys are running the Berlin Marathon together, and I'm sure not together, but you're both running it, and I'm sure you'll meet up.
Oh, absolutely. Yes.
But it also just went to show that it puts things into perspective, right? And it also put things into perspective when we were at the hospital with you, and it literally felt like a Grey's Anatomy episode where all these people are being rolled into the hospital on stretchers with bandages on their head and their race bibs on their stomachs.
Mile 12. I hope they, do something about mile 12 next year, because it got a lot of people.
But it's not just mile 12, right? It's the entire marathon, and it just goes to show that, like, you're not alone in the experiences that you're having. Even if you feel like the worst thing ever has happened to you, just know that there's other people experiencing maybe the exact same thing, right?
Absolutely, Kate.
Yeah.
Yes. We're not alone.
We're not alone.
We are never alone.
And was that nice for you to be able to connect with Megan?
Oh gosh, yes. Yeah, and we've done countless emails back and forth since then.
Phone calls.
And yeah, talked on the phone. I can hardly wait to meet her in person. But maybe it'll be at the Berlin Marathon. We'll see. But just amazing how connections can arise from social media.
And in mysterious ways.
Oh, yes, absolutely.
Well, let's leave everybody with one final piece of advice. From you, psychologist, Dr. Dana Lebo, performance coach. Give us one piece of advice that you want everybody to take away from this episode.
Well, I said this even in the running interview we did. I do believe in KFG. Keep, again, whatever you want the F to stand
You
for.
can curse on this podcast.
Okay, keep fucking going. Just that's one piece. And when you need to press the pause button and rest and recover, allow yourself that as well. But don't be too mired in one and not the other. Find that sweet spot. Keep going, rest, recover, keep going, rest, recover, but find your sweet spot. And also, everyone has meaning, purpose. Keep running towards that. Whatever it is for you. Find your meaning, find your purpose if you don't have it already, but you probably do. And know what that is. Keep going for that.
Yeah, just keep moving. And, I ask people, like you said, I ask people in every single one of my running interviews, what is a quote or motto that you live by? And some people think it's catchy and, or kitschy, whatever the word is. And some people think it's, maybe like a lame question, but I actually love the question because you never know what people are going to say. And it's always the short quotes that always stand out to me. It's not the elaborate quotes, although, you get a lot of people that quote the man in the arena quote, which I always do love. But things like KFG, these simple mantras that we can replay in our head are the important ones, right? And it's the ones that stick with us in those hard moments. And the ones that have always stood out to me are ones like you said, KFG, keep fucking going. There's another one, Nicholas Thompson, we mentioned him in this episode, but his is right foot, left foot, right foot, left foot, right?
Gosh.
Simple. And then the one that I always think about is you can't be 100% all of the time. And a big time runner said that to me. And that's always been my favorite quote because I think as athletes and as runners and as people that value working out, we hate those moments where we have to turn it off, right? And the foot can't be on the gas, right? The gas pedal the entire time. But it's important to remember that you can't be 100% all of the time. And you have to have moments where you reset. But then you have to have moments too where you decide, okay, I've reset. And now I have to just keep moving.
Yeah. You said it, Kate.
So
keep moving. And whatever you can do to help the world, keep moving.
Yeah.
I'm 100% behind you, and we all are.
Well, thank you so much, Dana, for being on our podcast today. I'm feeling good. I hope your post-run high
Absolutely
has kicked into full gear by now.
Definitely, and I think it's gonna last for some time, Kate. Thank you.
We are currently in Palm Springs, California. We are just wrapping up a family Christmas trip that we've been on for 4 days here. We've been coming out to Palm Springs for a few years now. Next year might be a different location, who knows? But as a reminder, Jeremy and I are in California for the next, several weeks. We're going to be here till the end of February. And then we're going to be in Austin, Texas for a week, filming with some other really cool guests like Dana. But if you guys have questions for Dana, she might be visiting California in the next couple of months while we're out here again.
Give me an excuse to come back, Kate.
Yes.
I'm so, again, honored that I was included in all this, and the whole family. First of all, so thrilled to have you a part of our family now, and I know it's still new, and we're just so excited that you're a part of this clan, and whatever we can do to support you along the way, we're here for you.
All right, well, one of the things that we can do to support is, guys, if you have any questions for Dana coming out of this episode that we did not answer, please DM me on Post Run High or at Kate Max, and we will write all of your questions down. And the next time we are sitting down with Dana, we will be sure to answer them. I'm sure there's a lot of questions that came up to you, and I apologize if I didn't scratch that itch for you during this episode, but we'll do it next time.
Thank you so much. I really enjoyed our conversation, Kate.
Thank you guys so much for listening to today's episode with Dr. Dana Lebo. I hope you enjoyed our conversation as much as I know our team did. If you guys are getting a lot of value out of Post Run High, please make sure to follow this podcast and share this episode with somebody who could learn a decent bit from it. We love you guys and appreciate you so much, and we will see you next week on Post Run High. As always, our DMs are open. Any follow-up questions that you have for Dr. Dana Lebo, please slide into our DMs and ask them, and we're always open to guest requests, so keep us posted on what you're thinking and who you'd like to learn from next.